Hello, I'm Dr. Harish Seneti, oral and maxillofacial surgeon, life coach and Ved Sahasra Path instructor. This video is for all my fellow doctors. It can be dentist, it can be homeopathy specialist, it can be Ayurvedic, it can be naturopathy, it can be anyone who has this tag of doctor, or students who are aspiring to become doctors. You can be a third year student, fourth year student, interns, house surgeons, or PGs who are sitting at home. Please come out. This is the time for us to become united to fight this pandemic. There can be a third wave, fourth wave, fifth wave. Recently, Japan is facing fourth wave. So this is not going to end if we don't act now. This is the time we should prove that doctors are for health, not for disease. So I request all of you who has this tag of doctor to come forward and start looking at patients in clusters. Like suppose you are in an apartment. Make sure that you give your phone number to your apartment president, or circulate in your colony, or circulate in the cluster where you can reach out and tell them if they show some symptoms and signs, tell them to reach out to you. You need not charge them, or you can charge them minimal, but tell them if you can catch hold of your COVID patients at mild stage, you can prevent them to enter into severe and hospitalize them. So all we have to do is catch hold of the disease early. Now this is the time you come forward, you tell your colony president or your apartment association that you have doctor at your disposal. You can contact them for opinions, for second opinions, for for suggestions, so that any mild moderate cases you can manage at home. You can manage them over phone, so that you will reduce burden on hospitals. Hospitals, our fellow doctors who are house surgeons, interns, who are postgraduate students, or who are doctors who are working day and out, anesthetists, pulmonologists, they are dying in PPEs. You will reduce their burden if you can catch cases who are mild and moderate and treat at home, rather than they taking this government given kit. They don't know what to do. They take what tablets they know and they start their own treatment. They get confused. They delay it. Then they wait till the oxygen dips, and then they come to hospitals, and they burden hospitals. Now we are facing this second wave. We will be soon entering into third wave, and we don't know when this will go. So now this is the time for all the doctors to build trust in your patients. Not for money. Do not live on disease. Start living for health. I don't say don't charge, but charge minimal and start addressing patients at a very mild level, so that you don't cause burden onto the government structure, not onto the hospitals, nor onto our fellow doctors who are really dying in PP kits. Please understand and come forward. So what I'm trying to suggest is, make a cluster. Make sure that you give your phone number, or you help people around you. Okay, give your phone number, create a protocol. If you don't have a protocol, I will personally, with my 20 doctors team, I will give you a personal protocol file. You can download it, you can print it up. You can see oxygen levels, pulse oxygen, pulse rate, oxygen levels, and their weakness, if they are becoming weak, if they are becoming strong. You can see this, you can write it down, maintain their chart, so that you help them. You tell them this is still mild case, you can still stay home. This is moderate severe case, you now have to go for oxygen therapy. So you can do this, you can help your patients. These days don't know what to do. Patients are like at mild level, they are just admitting into hospital. One patient told me, sir, when I become severe, what if I don't get bed? That is why I'm admitting at mild case. So if they are mild and they are getting admitted, who are really severe, they will not have beds. This is happening because patients don't know. Patients don't know what to do. They think doctors will loot. They think some other treatment will work, and they are getting confused because of the kits and all. So what my intention is, if you can give that confidence to people around you, they can ask you for suggestions, and only severe patients can go to hospitals, and that will reduce burden on our fellow doctors who are working day and night in hospitals. And this virus is behaving weird, so you have to catch it at the earliest and start treatment. So as a doctor, this will become our responsibility to stop this pandemic. Come forward. If you are a student, take your seniors' help. If you are an established doctor and preparing for PG sitting at home, take charge of your fellow beings around and help them, give them more support, emotional support, and at least guide them where they have to go during the time of crisis. They don't know where to go, they are taking their own decisions, and they are getting confused. So all doctors, please come forward, and let's treat this as clusters, and whoever possible, wherever possible, start implementing in an organized manner. Suppose you don't know how to treat, I don't say that you treat even though you don't know. No, you at least monitor them and guide them where they have to go. That way you can help so many people without getting confused. These laborers, uneducated, illiterates, they may really get confused and become severe cases and burden our system. So this is the time for us to join together and fight, not blame on the government, not blame on doctors, not blame on public. No, this is not blame game. This is the time for us to educate everyone around you. All doctors, student doctors, please come out and educate people around you. And if you need any help, I'll leave my mail ID. Please put it in the mail ID section. Mail me. I will give you a format so that you can monitor them better, and in case they are turning into moderate to severe, you can always refer them to hospitals. DrHarishtenneti, Dr. Harish Tenneti is my mail ID at gmail.com. Please mail me if you are interested in this, and let's bring back faith in doctors.